I'm Robin Parker, and I'm the Technical Director at Atchison and Atchison. We are the manufacturers and developers of the AMELIORATE range. We're here today to talk specifically about the AMELIORATE hair and scalp range, and I'm with Trichologist Lorraine Turvey.
Hi Robin, it's nice to be here with you today. Thank you for inviting me.
Some people who are watching this no doubt know the AMELIORATE range. The history of it is really interesting, in fact, as it started with one product. That product is still very much the best seller, and it's the transforming body lotion. And since that day, because we've had such amazing results with the transforming body lotion, the premise of the range has been everything we produce must be transforming. It must have that transformative quality. Some of our customers who'd been getting on really well with the transforming body lotion had, in fact, when they'd had problems with their scalp, they'd been actually using the body lotion to see if they could treat problems. Now, we'd heard about this, so we decided to try and formulate some products that would work. Now, the best way of knowing whether they're going to work is not just asking individuals on a user trial, but actually work with an expert who could actually tell us independently whether these products were working. And that's when we met Lorraine.
I've been in the hair industry for 50 years this year, and 30 of those I've been a trichologist. So I've seen all aspects of hair and scalp problems. As a trichologist, we sit in between the doctor and the dermatologist for a go-to to discover what the diagnosis is for a scalp problem or a hair problem. We see a variety of range of dry scalp, very dry scalp to itchy, soreness, bleeding, psoriasis, seborrheic dermatitis. So we're looking for things that we can recommend to people that give them that clear scalp that tackles their condition and gives them a bit more peace of mind.
Let's start off exploring a little bit more about sort of conditions that this range is ideal for. And let's start by talking about the perfect everyday scalp routine that you as a trichologist would recommend. So I guess first of all, why is it so important that you look after your scalp?
Well, Robin, the skin on the scalp is no different to the rest of the body, but it's just covered with hair. If you see an abundance of hair for a majority of people. And it's like, with your face, you cleanse and you moisturize and you tone and you look after it and the rest of your body. And you should be adapting that for your scalp as well, more so because it needs to clean dirt and debris away from that get trapped with the sebum that can exacerbate the problems.
Right. Okay. So what would you, as a trichologist, describe as kind of the perfect routine for a weekly routine for somebody who maybe is suffering from a few problems?
Well, if somebody has quite a lot of, dry scalp build-up, obviously if it's a more serious condition, it's better to get the scalp cleaned professionally first. But this is an ideal range to maintain that. Because it's particularly the transforming scalp serum itself that you can leave in overnight, and that softens any dry scalp that people have, the flakes, the clarifying exfoliant the next day removes what the serum has softened, and then the clarifying shampoo which washes it all away, but gently, so you're not left with that dryness that can build up again afterwards.
Okay.
So, and to do that on a regular basis can only help people to maintain a good sort of scalp, word I'm looking for, a scalp condition.
Yeah. And I was going to ask you, you mentioned the exfoliation there, and that's, I think, something else that people are really, really interested in when they have a problem with scalp. And they may be tempted to, I guess, exfoliate quite a lot in order to try and remove the problem. Do you think, can you exfoliate too much if you've got problems with it?
Yes, if you're using a product that's a bit harsh, and it's a bit like the itch scratch cycle. You know, if you get an itch and you scratch it and you keep scratching it, eventually what the skin does, it builds up a protection because it sees itself being attacked. So
Right.
if you're using something that's gentle, a gentle exfoliator, a bit like your skin on your face as well, if you do it too harsh, then the skin becomes sore and dry, you know, so you get another problem. And it's the same with the scalp. People will, because they've got a dry scalp, they'll use something that will remove the scale, and then they might even use a scalp brush or something, and so they're scrubbing it away and causing damage, really.
What would you say? Obviously, the formulation we made for the exfoliation is, on your advice, fairly gentle. And how many times would you say is ideal to use it a week?
Well, I think the first thing is to get the problem under control, first of all. So you can utilise the exfoliator for about 3 times a week. And then, because you don't want to overdo it all the time when you're removing it gently, and take the problem under control. And then after that, use it as a maintenance rather than using it all the time to create too much for it. Although it is so gentle that I don't think it would be
too much harm. Yeah.
Yeah, to the scalp. Yeah.
Okay, that's good.
Yeah. I think what I'm trying to get at is over the skin you have what we call an acid mantle, and it's the natural pH of the body, which is about 4.5 to 5.5. And lots of products that people use remove that barrier, and that's what leaves it open, whereas this exfoliate doesn't. It leaves it soft and still maintaining its condition.
Excellent, good. Well, thank you very much. I think that's explained that section really, really well. Let's move on to scalp concerns now. Again, something that I guess, as an expert, you've seen an awful lot over the years of things that people have come to you with. What are the most common scalp concerns? Say, what are the top 3 that you tend to see in your practice?
Generally, it would be the basic pityriasis that people call dandruff, but it can exacerbate to what we call a pityriasis amentasea, where the scale adheres to the scalp and also adheres to the hair as well. So it makes it very difficult for people to control it properly.
Right.
So what we would do in the clinic, we would use more of a medical cleanser if it was very thick to begin with, to remove the scale, so that any products that you're putting on afterwards, such as the maintenance regime, will be able to do just that, maintain the condition for them. And that's why it's quite good, I've found, for me, for people to have the products at home that they can treat it with to maintain what we've removed for them. So.
Are there any other concerns that people come to you with?
Yeah, generally, I mean, yes, with the scalp, obviously, we would go into things like psoriasis, and in that case, that again is a maintenance, of removing the scale, because it's to do with the autoimmune system, and sebum, which builds up and can exacerbate a dry scalp condition as well.
Right.
We see people, and they've got to the stage where it's itchy, sore, bleeding. So it's to help the scalp into a healthy condition for them to be able to maintain it.
I guess this is a good point in which to sort of remind people that some of these conditions that you see, of course, are very much medical conditions. And with the AMELIORATE scalp range, which we've developed together, we are looking at a cosmetic product, of course. It's not a licensed product. But I suppose there is a distinction between when people have a really serious scalp problem, and that's when they need to see you for medical intervention, rather than that general maintenance, which, of course, is what the AMELIORATE range is aimed at.
Yeah, but for me, it's we use obviously medical pharma that we can use to clear the scalp and that. But it's knowing that once you've cleared it, people have got a regime to go home with to maintain the scalp for themselves, and they're not going to revert to using harsh products, oils on their hair, creams that will bring the problem back again.
Yeah. Okay. And I know from being a skincare scientist over the years, we've seen the effects that people with even dry skin conditions, and in fact keratosis pilaris, as I mentioned in the introduction, that can have quite an effect on people. Is it the same case with hair problems, with scalp related problems?
Absolutely. I mean, people come in, obviously we deal with hair loss and things as well, but particularly psoriasis, or even if it's a very, very dry scalp, flaky, you can get two types. You can get the dry flakiness, and then you get the one with sebum. So you get like the yellowish scales that form, and it's sticky and it maintains, it adheres to the hair, and people won't go out. They look at what clothes they're wearing all the time. People might revert to wearing hats, all sorts of things that, it's very embarrassing for them.
Yeah.
Really.
Yeah, I can imagine. Yeah, and I guess you may have, I think you've probably answered this already, but worth just maybe reminding people that if somebody is suffering from one of these scalp conditions, what's the first thing you'd suggest they should do?
Well, I think to get a proper diagnosis, because obviously there's lots of medical conditions that can be underlying, first of all. So if you visit a doctor or trichologist, just to make sure that there's nothing untoward going on. It could even be medications that people are taking that can exacerbate a dry skin and scalp, and then when you come to us, we would then diagnose the problem and then set up a regime for them to look after and maintain their scalp.
Okay, excellent. Yeah, thank you very much, Lorraine. I think that's answered that really well.